At the onset of the COVID-19 pandemic, Dr. Joshua Moskowitz fought on the front lines at the epicenter in the U.S.
Now we have a larger quantity of people showing up with a higher level of disease, and they're also infectious.
When hospitals across New York were overwhelmed with patients, the
Different
associate
levels,
director
different
of the emergency department at New York City Health and Hospitals Jacoby had to rework intake procedure in a way that would stop the spread and save lives.
We're actually working on the data right now to show that it actually worked remarkably well, that we were able to safely send people home.
A member of the disaster medical assistance team, Dr. Moskowitz brought the lessons he learned as a physician in the Bronx to Texas during the summer, when the state's average positivity rate more than tripled in just a month. When Wisconsin started seeing a similar spike in the fall, the public health professor took on a new assignment as part of a two-person hospital assessment team.
They have a lot of similar problems that we did, and we were able to draw upon our experiences. How do you surge in a facility? How do you adapt your staffing ratios? How do you change your testing practices? How do you change your procedures and policies? And so we were able to provide some guidance, but also assess and say, hey, to the government, we think this is where the most effect you're going to have to save the most amount of lives are going to be.
Now, back in the Bronx, his work continues.
If it does get worse, we're ready. We can't predict what's going to happen, but we'll keep adapting and changing and operationalizing to do the best we can.
In Morris Park, Amanda Bossard, News 12.